So we're coming to a close here, and I'm going to invite Dr. Gary Bennett up to give our closing remarks. Dr. Bennett is the Bishop-MacDermott Family Professor of Psychology and Neuroscience, Global Health and Medicine at Duke University. He directs the Duke Global Digital Health Science Center, which we partner with for this program today. And he also directs the Duke Obesity Prevention Program. Dr. Bennett is also president-elect for the Society for Behavior Medicine. And prior to joining Duke in 2009, Dr. Bennett served in the faculties of Harvard School of Public Health and the Dana-Farber Cancer Institute. Dr. Bennett earned his BA at Morehouse College and his PhD in clinical psychology here at Duke, prior to completing his postdoctoral studies in social epidemiology at Harvard School of Public Health. So please welcome Dr. Bennett.
Well, good afternoon, everyone. My iPhone is like my bedroom slippers? That's my takeaway quote for the day. It's totally true, too.
I'm glad you were listening, Gary.
I absolutely was. I'm going to go home and tell that to my wife. So I am, first of all, thank you, everybody, for attending. And thank you for attending, but thank you for staying. It is astounding to see so many folks here at this late in the day, especially when it's such a beautiful day outside. So thank you all very much. It's a great credit, I think, to the team that put this together, that we've had such a wonderful afternoon. So let me just thank our speakers, our invited speakers, and maybe we can give them all another round of applause. So, Bill, Donna, and Aaron were just absolutely fantastic. And I think one of the things, aside from their wonderful talks, we expect them to be great. But one of the things that really stuck out to me was the number of fantastic speakers that we had from really all levels, academic levels. There were students, undergraduate students, and postdocs, and all manner of folks in here today. And I think that reflects both the youth of the science, but also the greater democratization of this area and what's possible these days. So thank you all for attending. I just want to, before I actually go on, let me just acknowledge the folks who put this together. And I'd like to say thank you to Erica Levine, who makes most of all of these things possible. And Callie Davis-Penders, who's working so hard that she's not in the room. And Jacob Christie and Jasmine Burrows and Shelley Lanford for taking notes. And so thank you to all of you, and also to the founders of mHealth at Duke, Joe McClernand and Bernard Femmeler, who you've been seeing all day. Some of you may know that we are losing Bernard to some place a little further north of here, whose name shall not be spoken. And nevertheless, we are all broken up. Bernard has executed just unbelievable leadership over this area for the last half decade almost. And a lot of what has happened here at Duke in the area of mHealth is largely a credit to his leadership. So thank you, Bernard, for what you've done here, and we'll miss you. Just say a few things, and then, as Donna said, we can all go get our drinks. I was struck today by a couple of areas. I've been in this area for a while and have been thinking about digital encoding for a long time, and it's been unbelievable in just the last 5 to 10 years to see the growth in this area. And just in the last couple of years that we've been doing this conference, it's amazing to me to see the transition in this space. And so a couple things that stuck out to me. I think one is that I think we're seeing this transition to what we can think of as actionable insights. Like in the early days of mHealth, we were all very excited to slap devices and sensors and apps on people and collect huge reams of data. I know, we get really excited when you exceed a terabyte of data on a given person, and it's wonderful to collect those data. And then the question ensues, what am I going to do with all of this? And how do I make sense of it? And I really think we are crossing over that sort of inflection point now, where we're starting to see people actually making use of the data in ways that are clinically relevant and that have relevance to population health as well. And that's a particularly exciting for me. That perhaps is the aim of the PMI, and so I think we're going to see even greater potential there in the near future. But I think just what we saw this morning was very exciting. We're sort of beyond collecting and we're moving towards changing. One of the challenges, though, that I think we're going to have to face in this space is that, particularly as it relates to medicine, are there any providers in the room? How many? Okay, we have to work on that for next year. So for all of you who are training providers, perhaps I won't even ask, I'll just assume that many of you are. For all of you, one of the big challenges we have is that much of what we do in mHealth is about collecting real-time historical data in context that's linked with a variety of other types of data. And unfortunately, modern medicine is not currently practiced that way. There are very, very few examples in which a provider looks at data that are collected in real time, or that looks at multiple sort of longitudinal data, or considers contextual influences on the data. And so I think what we're going to need not only is a shift in the way and understanding the best ways to present data to providers as one example, sort of thinking about Ryan Shaw presenting the data of 6 people over time and the reams and reams of data. We need to know from a very basic health communication perspective, how do providers want to look at those data? And if it's not going to be an MD or primary care provider initially, how do RNs and medical assistants make best use of those data? That's really basic health communication research. And then for the data that we're feeding back for patients, we need to really understand better how to give patients data and metrics that they can use. We do work in medically vulnerable populations, and one of the things I think we've realized over the years is that real people don't actually like numbers very much. And yet, those of us who do this work often love numbers and love collecting data in the most arcane ways possible. And so we just need to be thinking about new ways of presenting those data to really make our actionable insights actionable for patients and their providers. The other thing that stuck out to me was, I think, we could have had a drinking game on the number of times I heard engagement today. And engagement comes up over and over. And of course, I think it is really the linchpin of this area. We know that in my area of digital health for weight loss, when you use more, you lose more. And there probably is nothing more important than identifying ways to get people to engage consistently and over time. And yet I was struck by the variety in the modes and the channels and the delivery schedules and the delivery strategies. And some of us are using email and IVR at different times of the week and text messages and apps, some with notifications, some without. I love that so many people are including imagery of their apps, and yet the design varied considerably from one person to the next. And so I think one of the big challenges we're going to face in this space is I think we need a new science of engagement. I sit on a study section now where we're just beginning to finally see grant applications come in that propose engagement as the primary outcome. And I think in this area, there probably is nothing more important than new theories that are not focused on changing outcomes, but that are focused on changing engagement patterns, and that look at trajectories of engagement patterns over time. I forever will think about Donna and her chocolate bar when I think about engagement. But I think that visual representation really captures the challenges. You could have replaced chocolate with your iPhone. And in fact, most of us have them around all the time, but a variety of things will get in the way and change the way that we interact with them. And we need to know more about that. And I think probably central to that endeavor is what came up in the very last question, which is thinking more about design. I'm a behavioral scientist, and I started doing this work before people had computers at their desks. There was really only one way of designing a paper material. I mean, you could get a good graphic designer, and maybe if you had print shop, you could make a really pretty border, or put some colors on it or something. You could jazz it up just a little bit, but there's sort of a threshold there above which you can't do much more with graphical design on paper communications. But now there are just infinite ways for us to design web pages, not to mention survey data entry interfaces for many of our mobile apps. And those kinds of changes and the variability in design have real live implications. Anyone who's talked to me for more than about 5 minutes has heard this anecdote, but if you go back to the original Obama campaign, on a single day in 2008, the Obama campaign pilot tested different subject lines for their emails. So they sent out a single campaign donation email. The copy was exactly the same. And all they did was to modify the subject line. They used 18 different permutations of subject lines. If anybody is a Democrat in the room, you probably got some of these, and they would say, like, I need you now, or we're about to lose, or give us money immediately. They tested 18 of these, and the difference between the best performing and the least performing subject line was over $2 million on a single day. $2 million in donations, varying only the subject line. Design matters, it matters a lot, and we can spend a lot of time with creating great theories and great methods and having great ideas, but if we design horribly ugly interfaces that are not usable, then we'll just get bad data. And so I think this is an area where we need a new science of engagement, and I think part of this needs to be greater interaction with those folks who think about user experience design. And then finally, I think the thing that I'm really excited about is to see what I'll call like bespoke apps. the idea that when we started doing mHealth, many of us were creating digital pamphlet racks, right? We were taking, it's a term my colleague Vic Strecker used, and it basically means that in the early days what we were doing was taking what we had in brochures, our kind of big pamphlet rack that you sometimes would see at your doctor's office, and people were just taking those pamphlets and putting them online on websites or kind of putting them into apps. But we weren't really using what's special about mobile devices, the fact that they are in context, that they can prompt us, they can use notifications, they have GPS, they have sensors, passive and active. We weren't really using those to help to inform intervention design. We were just doing our same old thing on a phone. And I now finally am seeing this transition towards creating apps that are really customized and tailored for what phones do and for what phones do well. Daniel Chandler's a really good example of this, a guy who just builds with a 3D printer a portable spirometer and is now really changing, I think will very soon be changing the way that we treat asthma, or in Donna's talk looking at the many ways that sensors can be used and increasingly are being used. We're starting to think about doing work in digital biomarkers, and Bernard this morning was talking about, I guess, mobile omics, right? This idea that we're finally deciding to actually use the advantages of these technologies for good clinical ends. And so the challenge there, I think, will be what Bill said, and I don't think you can say it better than the way Bill said it, and that is we need to be figuring out what works for whom, when, in what context, and in what combination. And that's going to be the challenge for us who do research in this space going forward. So thank you all very much. Thank you to our speakers, and we will see you next year.